This is Dr. Kahl Goldfarb with Water and Sports Physical Therapy, and today we're talking about Chondromalacia Patella, also known as anterior knee pain or patellofemural pain. So first we're going to describe what it is, and then I'm going to give you my 3 favorite exercises to help eliminate this problem. So first of all, here's a model of the knee. If we look here, we can see you have the patella or the kneecap that butts up against the femur. The patella should ride inside this groove. Multiple things can cause that patella to ride on the outside of the groove and cause damage to part of the kneecap. That damage is cartilage damage that eventually wears cartilage away. And then once cartilage wears away to bone, bone to bone touches and there is severe pain, usually accompanied by significant swelling. Now, here's the problem. With patellofemoral problems, with cartilage degeneration, you don't feel it when you're younger. Typically, you feel it when you're older. It might manifest itself as patella tendon pain above or below the kneecap, or you might have some general achiness. But for sure, when you get to your late 20s, early 30s, and the degeneration gets worse, you will feel significant pain in your kneecap. So, what are some of the causes? First of all, the most common cause is that we have a tracking problem in the kneecap. Very tight quads. The rectus femoris, one of the quad muscles, pushes tight against the kneecap. This tightness grinds the kneecap. You might feel like a grinding sensation, and that's the kneecap grinding against the femur. The other problem is mechanics, where sometimes the IT band that pulls the patella laterally will pull that kneecap to the side, and then you get your grinding. So when you bend your knee, you will feel more grinding because you're not tracking correctly. The other problem you can't forget about is the ankle. Often the ankle mechanics, you don't have enough motion upwards, which is dorsiflexion. You need to stretch out your calves. And if you feel a bony block, a sensation in front of your ankle, it means you have a talocrural joint or ankle joint block, which can be treated in physical therapy very easily. But if you feel that pressure in the front of your ankle, you should definitely see somebody for that. If you don't feel that pressure, make sure your calves, your gastrocnemius and soleus, are well stretched out. So, back to what we do for this problem. There are 3 main exercises I like to give our patients. And usually, we try to work on flexibility at first. First is flexibility. Once you have the correct mobility, then you move to strength. I don't care how strong your VMO is. If your VMO is a Hercules VMO, but you are tight and the motion won't allow to go medially or inside, you will not be able to track correctly if you're too tight on the outside. So, first we're going to look at quad stretching and then how to do soft tissue massage on the IT band. So I'll have my assistant here, Lindsay's, come on over. We're going to grab the belt for us. So what we're going to do is we're going to show you first the basic rectus femoris stretch, quad stretch. And I'll use a belt, you could use a rope if you want. We'll just place it around the ankle. And we'll have her bend her knee. We'll have her go against the wall for balance. So we're going to bend her knee up in the air. What I want her to do is bring this across the opposite shoulder. We want the knee to be at an angle so we're pulling this way. If you go out this way, that's bad for the knee mechanics. So we'll bring it this way, have her knee lined up with the other knee, and we're going to have her pull, okay? So what she does, she has a nice steady pull. Now, very important, rectus femoris attaches all the way up at the AIIS, anterior inferior iliac spine. So what you do is you pull your pelvis under. Then, once it's under, then she comes back. And then she pulls, and that's all she's got. So you need to make sure you're not doing like this. This is useless. You come back here, then you pull. Now, if we want to bias the IT band a little more, tensor fascia lata, we'll bring it in and then pull, okay? That will get a little more bias laterally, which we need to release in order to have the kneecap line up properly during mechanics. So we'll let her go here. Keeping that strap on, we're then going to work on foam rolling. You can get foam rollers all over the place. The key is I see a lot of people foam rolling where they're just lying on it and just massaging over the tissue. Now think about this. What we're trying to do is elongate collagen. We're trying to tear collagen, make it so it has more length. Rolling something like this isn't going to do that. It'll inhibit muscle tone. It'll inhibit pain, make you feel better temporarily, but it will not elongate the tissue. You have to put the tissue on full tension, then you can work on the roller to try to break down any scarring adhesions. So, we'll have Lindsay lie down in a plank position. And we're going to have her roller right on her thigh. We're going to have her bend her knee up like we had before. Take full tension right there like that. Pelvic tilt, so she's there up high, and then she's going to roll on it. Now what's happening here, now she's going to find certain areas that are tighter than others. She finds those areas, she stays on those areas. You don't want to roll through the whole thing. We're trying to do more of a, sort of like an ART technique, not quite, but you're trying to release the tissue slowly. She can also roll onto her IT band, where she goes sideways like this. So this will allow her, I'm sure you guarantee she's not very comfortable right now. Is that right, Lindsay? So she rolls on those areas. You want to slowly work your way down to right on the outside where you have a lot of pressure on the IT band and lateral retinaculum, which attaches to the kneecap and pulls it out. All right, strengthening. Let's start with a basic strengthening exercise. What I suggest to do is don't worry about brute strength. What I want to do is I want to make sure we're looking at control. It's about tone. It's about firing patterns, making sure your VMO and the rest of your quads are firing at the same time. So all about movement and control. So we're going to do what we call a slider step back. So we're going to have her stand here. We're going against the wall in case we need a little extra support. She can hold here to begin. And we're working on this quad here. She's gonna hold this muscle right here. Try to engage the quads first and slide the other foot back. Now what she's trying to do is trying to avoid going in, which is called valgus, avoiding this position here. She's gonna try to avoid having her hip come out. Quite often, the gluteus medius, the stabilizer of the pelvis, is weak. And that's why you get this poor mechanics. And you increase the Q angle, which is the angle like this. So if she comes out this way, bring your hip out. If she goes like this, that's very bad for the kneecap alignment. It's gonna pull the kneecap out and cause that grinding. So, right in the middle, step back forward like you did, and slide back again. Watching this motion and this motion. Knee shouldn't come in, knee should never come over the toe, slide back. I guarantee you, pro athlete or anybody, you will get fatigued and you'll get a burn if you do this correctly. The goal is to let go of the wall eventually and slide back. There is a decreased amount of patellofemoral compression in this position. Whereas if you're doing squatting, a lot of times your knee comes over your toe and you move in the bad alignment, and that will increase patellofemoral compression. Whether you're in pain or not, that was good. Whether you're in pain or not, you want to do these exercises and do them correctly. If you do them incorrectly and it doesn't hurt, it doesn't mean you're not hurting your cartilage. It does not mean you're not degenerating the joint. It means you don't feel it yet. And I guarantee you, if you have faulty mechanics, eventually you'll be seeing us or somebody else like us. So, be safe, do your exercises correctly, pain or no pain. This way you can stay out of physical therapy. Any questions? Visit our website at waterandsportspt.com.